My name is Ruth Castellano, and I'm Vice President for BJC Home Care Services. I was diagnosed in the summertime with a terminal illness, a very rare disease, and had gone to Mayo Clinic and Boston University to try to get a heart transplant and a stem cell, and was turned down. I basically had somewhat come to a part in my life where looking at different options and what there was to happen, and talked with a physician and felt that hospice was the most appropriate area for me to be in, just to live my last days to the most fullest and to enjoy and tie up some loose ends that I felt needed to be tied up. It's about living life. It really, truly is. And the support that the staff will give you to work around your schedule, because you still can be out and about. And like I say, I have continued to work mainly from home, but go into the office, but they work around my schedule and appointments I have. There's someone on call 24 hours a day, 7 days a week. And sometimes you can't control when things go wrong. But there have been times on a Sunday or in the evening where I've had things come up where there is no other way around it. But that constant support and people that know you and know what's best for you are there to help you.
I'm Suzanne Doyle, and I coordinate the Lumina program for BJC Hospice. Lumina is mostly a volunteer-driven program in which we have the privilege of entering into terminally ill people's lives, to do the review of lives, to have a chance with the patient to reflect on their lives, to come to some sort of peaceful conclusion about their lives, to remember falling in love and the great successes of their lives, and sometimes the sadness too.
There's lots of questions that she'll ask me that I never really thought of putting in words. You know, what is the afterlife? And a lot of people don't have time to talk through those things or work through those things, or even how they feel about death. I think it just helps you feel at peace, not only for me, but for my family that I'm leaving behind. Just making sure everybody has the opportunity to verbalize how they feel, what they're feeling. Suzanne designed this box for me, so it's got a little bling, it's got my name, it's got a little high heel here on the back, and on the inside of this, Suzanne asked me what I wanted to leave, what I wanted people to remember about me. So it says, I hope for people to remember my positive attitude, my can-do spirit, my passion for my work and for everyone I love. I hope people will remember the openness that I was comfortable with and who I was. This is what I wish for you. Be confident. Never be afraid to acknowledge the people who have helped make you who you are, and look forward and not backward. So those are just kind of words of wisdom that I want to leave behind, but they're painted on the top of the box so that my family, again, can always have that, or people that are so close to me.
The kinds of services that we provide offer people the opportunity over their last weeks and months to live as rich a life as they've probably ever lived. And that's true of their families as well. Their families have a time to step out of the world of hospitals and many medical procedures and just be together in this particularly precious season of life.
My name's Courtney Sedano, and my mom is Ruth Castellano, and she's in hospice.
Taylor Sedano, and Ruth is my mother.
I would 100% recommend BJC Hospice to a friend, family, anyone, because I just think the awareness needs to be raised of what it really entails and can help you. I think it's been a great emotional help for me.
Yeah, I would completely recommend BJC Hospice. They provide a weekend camp free of cost to children who are grieving, as well as a day retreat for kids. There's another retreat for mothers. There's just so much that they're offering, and not only to people like us who, you know, a parent, a family member's on hospice, but it's open to the community, some of these other programs, and they're great, and I think anyone would benefit from being a part of it.
Too many people go into hospice at the last moment. It's not really giving up. It's actually living life to the fullest, and it's about being comfortable in life and support in what you want to do and how you want to operate your last days. I think a lot of people feel that you never can see your primary care physician if you go into hospice, but you know, they can work collaboratively with the medical director of hospice, or you can just choose to stay with your private physician if that's what you want. But again, it's not about death. It's not about taking morphine and dying, and you know, it's about living life. It really, truly is.